begin. Hello everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now in this episode, I'd like to expand upon the coronavirus's effect on multiple organ systems from a Chinese medicine perspective. As I'm sure you've already seen in other episodes pertaining to the coronavirus in which I've done, you've learned how the coronavirus can affect the lungs, heart, kidneys, brain, spleen, and stomach, as well as the liver and gallbladder. Again, I will suggest, if you have not watched the episodes on the basic functions of the lungs, heart, kidneys, stomach, spleen, liver, or gallbladder, pause this episode and go back and do so. Now, as I've discussed in past episodes, a basic function of Chinese medicine pertains to the balance of yin and yang. Once a practitioner has pretty much restored balance within the human organism, i.e. homeostasis, the body can then pretty much heal itself. Now in Chinese medicine, a disharmony in one organ system usually introduces an effect of excess or deficiency of other organ systems. Now in the case of the coronavirus, which usually attacks the lungs first, in Chinese medicine, the lungs control the Wei Qi, which is our initial line of defense against pathogenic Qi. If our defensive Qi is stronger, it will expel the pathogenic Qi. If our defensive Qi is weaker, the pathogenic Qi can then move from the external level to the internal level, creating a myriad of imbalances with our yin and yang organs. Now let's take an expanded view of how the coronavirus impacted multiple yin and yang organs as a result of the lungs having been adversely affected by this virus. For example, the lungs and heart in Chinese medicine, they are both yin organs and are heavily dependent on each other's functions. Both the lungs and heart can have clinical manifestations of shortness of breath, cough, tiredness, depression, and sweating. Similar symptoms presented with the coronavirus. Now let's consider heart and kidney relations. Now, if the heart and kidney, which are both yin organs in Chinese medicine, are not harmonized, you can have signs of mental restlessness, dizziness, night sweating, and dry throat. Another can be disharmony between heart and spleen, which are also both yin organs, and that can lead to heart and spleen blood deficiency, which can display symptoms of dizziness, anxiety, pale complexion, tiredness, weak muscles, and loose stools. Now, disharmony between the lungs and spleen, which are also two yin organs, can lead to lung and spleen qi deficiency, which can display symptoms of lassitude, poor appetite, weakness of the limbs, loose stools, and a tendency to obesity, shortness of breath, cough, and sweating. Now, let's look at an example of both yin and yang organs being affected. Let's look at the stomach, which is a yang organ, and the spleen, which is a yin organ. Now, if there's disharmony between this yin and yang organ relationship, and also remember, the spleen and stomach are responsible for your postnatal qi as well. It can lead to stomach and spleen qi deficiency, which can display symptoms such as poor appetite, uncomfortable feeling in the epigastrium, loose stools, weakness of the limbs, and loss of taste. An individual can also develop stomach and spleen yin deficiency as well. Those symptoms would include nausea, poor appetite, dry mouth, and tiredness. There can also be disharmony between liver and spleen, both of which are yin organs. Liver qi can become rebellious and invade the spleen, which can display symptoms of abdominal pain, tiredness, and sometimes there can be loose stools, among others. Now, rebellious liver qi can invade the stomach as well, whereby in this case you have a yin and yang organ disharmony. Symptoms in this case can display as nausea, weak limbs, and vomiting, among others. And now going back to disharmony between two yin organs, liver fire can insult the lungs, manifesting as breathlessness, distension in the chest, cough, headache, and dizziness. Another combined pattern among yin organs, I wouldn't say yin and yang, but yin organs can be liver and heart blood deficiency manifesting as dizziness anxiety, pale complexion, muscular weakness, and depression. Another yin and yang organ disharmony can be between both the liver and the gallbladder. Symptoms in this case can display as nausea, vomiting, fever, dizziness, loose stools, and alternating hot and cold feeling, among others as well. Now, notice how a lot of these symptoms reflect those of the coronavirus. As stated in my other coronavirus episodes, it's not just the lungs that are affected as a result of being infected by this virus, whereby, as an acupuncturist, when I construct a treatment protocol for my patients who've been infected by this virus, I have to focus on other yin and yang organs outside of the lung organ that have been affected as well, and construct a treatment protocol that would include reestablishing a balance among the affected organs. Now, don't forget to subscribe to my show to learn more about Chinese medicine and acupuncture. And until next time, acupuncture is my life. What's yours?